My father was a crackhead. I grew up on the east side of Cleveland. They're preying on people like me. And I feel like these doctors, they don't care about you. They don't care. They're preying on you. They're excited that in 3 weeks you're gonna have your tax return, and you're gonna send your money. You're gonna wire your money over to them, and they've never met you, and then you're gonna fly yourself back over here with all your complications that nobody wants to see you, and they're gonna already have your money, and you're not even gonna be able to get in touch with them. That's all they care about. They could care less. Now you're in the United States. You're not gonna sue them. If you could afford to sue them, you wouldn't have been over there in the first place. They're not even worried about that. They're preying on me. They're preying on people just like me. They're preying on my cousins. They're preying on my sister. They're preying on my mother, my friends, my girls, the people I went to school with. That's who they're preying on. That's why I care. Not because I want you in my office. I don't do butts. I don't do them. I shrink them. I make them smaller. When people come in and say, "Oh my God, I'm tired of all I can wear is spandex." I'm like, I'm your chick. That's what I do. I contour. I make the butt you got shape better. If I do a Brazilian butt lift on somebody, it's a person whose butt is as flat as a wall, and I make it look normal. I'm not gonna make a waist this big with big old hips to make you look like a caricature. That's not my thing. So I'm not doing this to get your money. I'm doing this to save your life. That's the only reason. Because I feel like these people don't give a crap about you. They don't give a crap. They put that girl in a mansion because they made her paralyzed. They owe her more than a mansion. But then I can't be mad at them so much because the girl knew she was going to somebody who don't give a crap about her, but she wanted the waist. So then it's like, both people are at fault. Just think about it. It's not worth dying over. So what I challenge everybody to do is try to go dig inside, and figure out why a small waist and a big butt is so important. What is it going to accomplish? Why is that so important? I'm confused. I don't understand. If you're trying to be a CEO, work in corporate America, be a soccer mom, a women empowerment person, you can't, that body doesn't even work with any of those things. So I'm wondering if you're trying to be a video vixen, okay, cool, I get it. Or a stripper, or maybe a model, like a model for like Vibe magazine or stuff like that. Okay, cool. That makes sense. But even if that's what you're trying to do, it's still not worth dying for. You won't even get to do it if you're dead. And a lot of these things that happen to these women can't even be fixed. So I guess that's all I have to say about that. I'm pretty sure I'm going to get... Let me just warn you too also. Negativity, evil stuff on my page, I will block you. I really don't care about what... Anybody who's mad at me for saying this, I really don't care what you think. So don't waste your breath, because I'm just going to block you. And that's pretty much it. Let me see if I missed questions, because I wasn't even looking. Kiara Taylor, a tummy tuck can be combined with lipo, sort of. I personally don't do liposuction in the central abdomen at the same time that I do a tummy tuck, because that increases your risk for necrosis. It increases your risk for dehiscence of the incision, which means the incision opening up, and it increases that's really the main reason. It increases your risk for tissue dying. So when I have a person who needs both liposuction and a tummy tuck, I'm gonna do whichever surgery has the highest likelihood of making them happy all by itself. So some women, I'm like on the fence about whether or not, sometimes I'm like, I think I can get you good with lipo, but in the chance that all the skin doesn't shrink, you'll need a tummy tuck. That lady, I would do the lipo first. Then there's some women where the skin's all messed up and I can tell their muscles are stretched way out. And I'm like, listen, let's do the tummy tuck first, because maybe this will be good enough. And if it's not, we'll do lipo later. It just depends. But if in the central abdomen, I don't like to do liposuction at the same time as a tummy tuck, but I will do it on the sides at the same time, like the flanks, the areas that I don't have to lift up all the tissue from off of the muscles. Yeah, I really don't care about the backlash of people. Like the people who get angry with me are probably the one. I know when I did this the last time, the main people who harassed me were one of them was literally sitting up in the Dominican Republic as we spoke, getting her second operation after her incision busted open, and she had to get dressing changes for months and months, and then she went back for a scar revision. She was exactly what I was talking about. You don't need to get defensive. Just open your eyes. I'm not dogging anybody. Everybody is different. We all like different stuff. We all think different stuff is pretty. That's what you use before and after pictures for. It shouldn't be to decide exactly who your surgeon is. You should be figuring out if it's a real plastic surgeon first. Then you go look at pictures, and then you see the style of the surgeon. So in that way, people are right. If they want a certain type of body, then you want to go to a surgeon who does that type of work. But not if the person's gonna kill you. That's the part where they lose me. So I don't really care about if somebody gets mad, because I know the intention of what I'm doing is good. I know that what I'm saying is from God. He made Dr. Myla Bennett a plastic surgeon because he knew my mouth was big enough and I didn't care. Well, I do care, but I don't care what other people think. He knows that my mouth is big enough and I'm brave enough to speak the truth to save some people. And I have saved some people because they end up in my inbox right after I do these things, telling me, thank you so much. Because of what you said, I canceled my surgery at this place, or I'm just not going to get surgery, or whatever. And that's what I care about. I don't care about somebody being mad at me because I said something about a doctor who kills people on a regular basis and don't care. They should be mad at that person, not me. I'm trying to keep people from dying. That's it. Let's see if any other questions. I have people stop smoking for about 6 weeks before surgery. And then I test their urine to make sure they actually stop smoking. Because I personally cannot stand when incisions come open. I hate it. So I don't take anybody's word for it, because I know smoking is hard. Quitting smoking is hard to do. And so if I test your blood on morning of surgery and your urine on the morning of surgery and there's nicotine in it, it's canceled. Because I don't feel like nursing no wound back to health for 2 months after it bursts open because you smoking cigarettes on it. So that's my personal rule. Yes, the truth offends people, but it's the truth, and all I'm trying to do is keep people from being hurt. So if they're mad about that, then whatever. Okay, everybody, I think I'm gonna go ahead and sign off. Just be safe. There's nothing wrong with plastic surgery if you're in a healthy mental space and if you can afford it. Don't take food out of your mouth. Don't take food out of your kids' mouths, and don't put your life in danger to get surgery. If find a surgeon that is actually trained, who was trained the right way in what they do, and save your money to pay. That's it if you want it. This last question I'll answer before I sign off. Birth control can increase your risk for blood clots. And so each doctor has their different protocols on how they handle people on birth control, but it can increase your risk for developing blood clots after surgery. And surgery increases your risk for developing blood clots, and not moving around as much increases your risk for developing blood clots. And so, the doctor will take into account all those things, whatever factors you have that increase your risk, and maybe they might put you on blood thinners temporarily after surgery, or maybe have you stop doing certain things. So that's something that you and the doctor that you choose to proceed with should talk about. Just make sure you're honest with all of your medical history so that the doctor can make a plan that's safe. And that's really it. All right, everybody. I'm going to go ahead and sign off. And be safe. I'm Dr. Myla Bennett of Ederra Plastic Surgery and Medical Spa in Johns Creek, Georgia. If you want to contact me, you can reach out to me via my website, www.ederra, EDERRA, so ederrabella.com, or you can call my office, area code 678-325-0006. Thanks. Bye.